Hi, I'm Dr. Mary Melancon, Medical Director of the Washington Women's Wellness Center here at MedStar Washington Hospital Center. A uterine fibroid is a benign tumor that grows within or near the uterus. It's quite prevalent. Up to 80% of women will have a diagnosis of uterine fibroids throughout their lifetime. Most fibroids are detected on clinical examination, so fortunately for most women, they are asymptomatic. But fibroids can cause lots of issues, most common being bleeding. It's the most common reason for a problem office visit to the gynecologist or provider. Fibroids can differ in size, ranging from the size of a pea or apple seed to watermelons. It's unusual to be able to determine the degree of symptomatology based on the size, because the pea-sized fibroid, if it's located in a strategic position, will cause excessive bleeding versus the larger watermelon-sized fibroid, which may have a patient present with no symptoms at all. There is no exact cause for uterine fibroids. We do believe it's multifactorial, and it can involve environmental exposures. We believe there's a genetic component to it, so we tend to see fibroids that run in families. We think there's a growth factor component to it as well. Exercise, we believe women that are more sedentary tend to have more fibroids. Diet, women who consume a diet that's higher in animal products, dairy products, tend to have more fibroids, but we really don't know the real root cause of what causes fibroids. The biggest risk factor is being of reproductive age. Fibroids tend to affect women prior to the menopause because in the menopause, they tend to stop growing. So symptoms of fibroids could include things such as bleeding, pressure symptoms such as the fibroid pressing on the urinary bladder, so women tend to have to urinate frequently. There can be some issues with fertility depending on where the fibroids are located. That could cause women to have difficulty conceiving or cause problems during pregnancy. All fibroids do not need treatment. We tend to treat fibroids or intervene with medical or surgical management if the woman is symptomatic. Again, 80% of women having fibroids, that's a large amount of women that we would be treating unnecessarily. So women that have symptoms are the women that we tend to treat. Fibroids are usually diagnosed on a clinical examination. During a routine physical examination, the provider may detect that the uterus is larger than normal. And if that is the case, then the patient will likely be sent for some sort of imaging study, most common being a pelvic ultrasound, to determine the number, size, location of the fibroids. My patient care philosophy is treat each patient individually where you meet them. If they're totally asymptomatic, we're going to take that watchful waiting approach. If a patient is symptomatic, then I know that I can improve her quality of life, whether it be with a medical approach, procedural approach, or surgical intervention. That's how I approach each patient individually.